All right, so that's the lead story for this week, an important movement. Before I comment on the story, I just want to say this is absolutely the right objective. To get a complete longitudinal patient record at the point of care cannot be argued as a worthwhile and an important goal. And Chime is doing exactly what we've asked them to do, which is to move the National Patient ID forward in pursuit of this goal and this objective. And this is something I'm very passionate about. So if this gets a little more passionate than usual, if it comes off as a rant, I apologize. But I really do have three fundamental issues with this approach. And they are, the first is I think it creates a false sense of security or really a false sense of accomplishment. Everyone who's approving of this feels good about themselves. They feel like they've solved a problem, but they really haven't solved anything. They've opened up a funding mechanism to solving the problem, which means we're looking at 5 to 10 years before anything of substance really happens in this space around the national ID. So that's the first thing. I feel like we've created this false sense of accomplishment by getting a national patient ID. I don't think it solves the problem. And why doesn't it solve the problem? Which gets to my second problem, which is I just think it's the wrong solution. A national patient ID is a rabbit trail that doesn't solve the actual problem. The right solution, if you're wondering, is the patient. The patient should have the data. Apple already figured this out. The unique identifier is your telephone number, and when you request the data from your health system gives it to you on your phone, and now your phone number is the unique identifier, and you are the aggregator of the data. We just need systems that allow for that to happen. Get my data delivered to my phone. I can now go to the next health system and give them temporary access to my medical records so that they can use it to care for me. And you know what? They can give it back to me when they're done because I don't really want you to have it. I mean, at worst, you're selling my information either consciously or unconsciously. And most times my data is just sitting there and it's not doing anything. And then the other false narrative here, or the false sense that goes on is because it's in the EHR, some people might look at it and believe it's a complete medical record, and it's never the complete medical record. I should be the aggregator. I am the aggregator. I am the constant at the point of care. Every time there is a point of care, I am the constant. The patient is the constant at the point of care, and that is who should have the data. It shouldn't be the government. It shouldn't be the HIE. It shouldn't be the Health Information Exchange. It shouldn't be the health system. It never should have been. We are horrible aggregators of data. We are horrible sharers of data. So I think Seema Verma and Secretary Azar have this right, and e-patient Dave, for that matter. Give me my damn data. Get it into the hands of the patient. Let me be the aggregator. The other thing that's going to happen as the patient becomes the aggregator is I think you're going to see a whole new set of data brokers that emerge. And this is going to be an ecosystem of data brokers as well as navigators and these organizations are going to have clinicians embedded in them that are going to help me to organize my record. They're going to help me to make sense of my record and to help me make care decisions. There's those in the healthcare community who feel like we can't trust the patients with their health record because that's not exactly the right way to say it. The right way of saying it is the health system, because I really believe the motives are right. And the motives are, I want to protect the patients from themselves. They don't know what to do with the data. Okay, I agree with you. I don't know what to do with my health data. I don't understand my health data. But with that being said, I think I can find a data broker that can help me. And I think that if we start giving the data to the patients, those brokers, those new organizations, that new ecosystem is going to emerge. And they're going to be able to help me to manage that data and to make sense of that data. If you want to put regulations around those brokers to make sure they have my best interests at heart, by all means do that. But what you're doing now, what health systems are doing now, is to continue to propagate a model that is broken. And that is not moving this thing forward. And there's this belief that all these competitive forces are just all of a sudden going to share data once we have a national patient ID. The problem isn't the national patient ID. The problem is the competitive nature of healthcare and the inability for some health systems to share the data based on any number of factors. Be it technical, be it desire to share the data. I had a situation as a CIO. I sat down with another CIO. I was asked to in our community to put together a health information exchange strategy for the good of the community. And I sat down with this other CIO and I said, let's talk about our sharing strategy. And he said, there is no sharing strategy. My organization does not want to share data with your organization. And I'm like, okay, that's the end of that conversation. And you know what? The national ID wouldn't have solved that. Now, that might be dated. That was back in 2013, 2014. Maybe there's enough regulations to push that organization to share data. But I'm not sure that that's the case. I think the answer is to get the data in the hands of the patients. But not to be overlooked, let's get to our third item, and that is that the ACLU's warning here about a dystopian future where two things happen. One is we make it really easy for the hackers. We take all the data, we put it in one location, and we tie it up in a little bow. We haven't proven we can secure our data. And then the second thing is, we're not really creative enough. We don't think creatively enough about what nefarious actors are going to do with the data. We think it's country A, B, or C is going to do something with the data, and that's not my concern. And that's really not the ACLU's concern either. The ACLU's concern is that HHS and other federal agencies, and what are they going to do with the data? Think about it. In light of our current political climate, when our political enemies essentially look at the things that you say and determine, I don't like what they say, let's see if I can go into their health record and see what sensitive information I can get from it. And if you don't think that's a possibility, the ACLU thinks it's a possibility, and I think a lot of other people think it's a possibility. I'm really kind of shocked that we think this is the solution, first of all, and then second, I'm really surprised it passed by the majority that it passed. I think people really want to wash their hands of this and say, hey, look, we did a good thing. I think directionally it's the right direction. Getting the complete medical record at the point of care is absolutely the right thing to do. But gosh, I just want us to think it through a little bit more, understand the ramifications, and just allow for a different way of going about this problem. I'm sure people are not going to be happy with this little rant, but I really believe that there's a different model out there with the patient at the center and data brokers and navigators emerging. And I think to a certain extent, we just need to get out of the way and let that emerge. So, if you have a point of view on this, please email me. I'm always open to be proven wrong and to discussing it on a future show.